There's a fatal flaw in this if you actually want to lower prices. There's no market in the world where you can have efficiency unless you have price discovery. And by not forcing, and I've already talked to the parliamentarian in the Senate, you can put price discovery in this bill and not have it thrown out on a bird rule. So who doesn't want price discovery? The insurance company and the hospitals. But you ought to, if you're going to go buy in a market, you ought to know what things cost. You ought to be able to look at the difference in prices, and you ought to be able to see quality outcomes. So no matter what they do, without that, you're never going to lower the cost of health care in this country.
And what do you think the chances are that there are shifts in the actual bill that are more in line with your thinking?
I don't know. I'm not a lobbyist up there. I haven't tried to change it, but my observation, I've said this for the 10 years I was in the Senate and the 6 I was in the House, as a former practicing physician and part of an outpatient surgery center, price discovery is what matters because people will shop it and they'll find it. I can buy if I want to shop it in Tulsa, Oklahoma, I can buy an MRI for $250.
Doctor, one of the big headlines that we're expecting this week, if not today, is to get some numbers from the CBO on what this all means and how they're going to score it. The expectation is that the headline, at least coming out of it, is that we could hear that 15 million people will lose their health care. A number of surrogates and others from the administration came on the air over the weekend talking about those numbers and how maybe we shouldn't think about those numbers. How do you think about those numbers?
Well, first of all, that's between now and 2020. That's 4 years from now. That's at the end of the fiscal year 2020. And most of that is whatever happens in Medicaid. It's not about what happens in the real market, not what happens in the insurance market. And if they do this right, if you were a smart governor, what you'd want to do is put personal responsibility on Medicaid patients by creating a medical savings account. Senator Burr, Senator Hatch, and Fred Upton have a good bill. I'm not really bent over bad on the tax credits because what we're doing is equalizing the tax treatment for individuals like we do businesses. So I don't think that's a problem, but I would like to see them clean it off and have something. What they're wrestling with is they don't have enough votes in the Senate. And so what Paul Ryan says, 99% of it's accurate. You got to send a bill that can not be bird ruled through the Senate.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.